Did you know that your bones are constantly repairing themselves even when you are perfectly healthy? In fact, every 10 years your entire skeleton is replaced. But when a bone breaks, the repair process goes into overdrive. Hi there, if you or someone you know has had a bone fracture, you might be wondering, how does a fracture actually heal and how long does it take? Well, in today's video, we'll explain the basics of how fractures heal and what can you expect during recovery. Hello friends, welcome back to the channel. My name is Dr. Nishant Singh, orthopedic surgeon. So let's get into it. First, let's get clear on what a fracture is. A fracture is essentially a break in the bone, but it can vary from a tiny crack to a complete break. The most common causes? Things like falls, accidents, or even overuse. Fractures can be as mild as a simple break where the bone doesn't pierce through the skin, or it could be as severe as an open fracture where the bone pierces through the skin. These differences affect the healing process and the time it takes to recover. So how does your body repair a broken bone? Bone healing happens in three main stages, and the process is more fascinating than you might think. Stage 1. Inflammation, 0 to 7 days. When a bone breaks, the body immediately sends blood to the area, forming a clot around the fracture. This clot protects the bone and starts the healing process by bringing in special cells. This phase lasts about a week. Stage 2. Bone production. Over the next few weeks, a soft callus forms around the fracture. Think of it as a temporary bridge made of cartilage. Slowly, this callus hardens and begins to turn into real bone. Stage 3. Bone remodeling. During this phase, the soft callus turns into solid bone. The bone becomes stronger and more structured, just like before the fracture. This process can take several months or sometimes even up to a year, depending on the fracture. So how long does it take to fully heal? Well, it depends on a few factors like where the fracture is, your age, and overall health. For example, a simple arm fracture usually heals in about 6 to 8 weeks, while a leg fracture might take 3 to 6 months. Larger bones like the femur take longer. The younger and healthier you are, the quicker the recovery. Now, you might wonder, is there anything I can do to speed up the healing process? Absolutely. While your body does most of the heavy lifting, there are some key things you can do to help. First, follow your doctor's advice closely. This could involve wearing a cast, avoiding putting weight on the injured area, or even surgery in most severe cases. Second, fuel your body with the right nutrients. Food rich in calcium, vitamin D, and protein are essential for bone healing. Finally, once the doctor gives you the green light, physical therapy can help you regain strength and mobility. Being active but in a safe way is crucial for a complete recovery. However, it's important to watch out for any complications. If you notice signs like increased pain, swelling, redness, or develop a fever, these could be signs of an infection or improper healing. Make sure to contact your doctor right away if something doesn't seem right. Now, let's talk about recovery times. It's normal to feel a little frustrated when recovery takes longer than expected. But remember, healing is a slow process and each body heals at its own pace. Most people are back to their normal activities within a few months, but full recovery, meaning your bone is as strong as it was before, can take up to a year. So, to recap, bone healing is a 3-stage process and the time it takes depends on the fracture and your individual health. Be patient with your body, follow your doctor's instructions, and take steps to support your recovery. Remember, patience is key. If you have any doubts or concerns during your recovery, don't hesitate to reach out to your healthcare provider. Thanks for watching. Be sure to subscribe for more health tips and recovery advice.